Good morning, everyone. I'm Kimberly Chalia with PHCA. Thanks so much for joining us for today's webinar. A few quick updates to share before we get started. This webinar is being recorded and will be made available on the PHCA website. The webinar has been approved for one continuing education credit for all attendees. For those who provided a NAB number, credits will be uploaded within the next 2 to 3 weeks. As we begin today, all attendees will be in listen-only mode. Please feel free to submit your questions via the Q&A icon on the bottom of your screen, and we'll make sure that we answer as many of those questions as possible at the end of today's presentation. And I'll turn it over to Tim.
Thank you, Kim, and good morning, everyone. Glad you could join me as we do our annual PHCA advocacy webinar, this year titled Politics and Building a Sustainable Future, Advocating for Long-Term Care in 2023. Today, what we're going to talk about is understanding legislative changes in leadership in both Harrisburg and Washington, D.C. There has been significant changes in the power dynamics, new faces in legislative leadership in both both forms of government in the way of Congress and our state General Assembly. We're also going to talk about relevant legislation and potential legislative impacts on long-term care, and then also talking through our legislative priorities, our budget advocacy plans for the next several months here in Harrisburg as we pursue additional not only investments in long-term care, but public policy that will strengthen the long-term care continuum as a whole. And then finally, advocacy plans and events, and really how to advocate to our lawmakers to make our industry more front and center to lawmakers, regulators, those folks who are ultimately impacting our operations day in and day out, whether we like it or not. So I'm first going to start with the shifting power dynamics in Harrisburg and Washington, D.C. As you know, we had a general election in November of 2022. And what that election ultimately presented to Pennsylvania is divided government once again. Governor Josh Shapiro took the oath of office on January 17th. He is now our governor. We have a Republican-controlled state Senate. That's a continuation of not only last session, but the last 40 years, actually, Republicans have controlled that chamber. Democrats did pick up one seat, so it went from 29-21 to 28-22. And then we have the most shocking and the biggest shakeup of Election Day 2022, which is Democrats for the first time in 12 years took control of the State House of Representatives. It took some time for them to fully realize their majority, as there were several vacancies out in the Pittsburgh, Allegheny County area. There were 3 seats that had to be filled. They were done so on February 7th. Democrats won all 3 of those seats. In the interim, between January 3rd, when all members of the General Assembly who were elected were sworn in, and February 7th, there was technically Republicans had a majority in the chamber. However, there was a compromise speaker's choice, which actually was a Democrat, Mark Rossi from Berks County, who ultimately presided over the chamber. And originally there was some political drama in that then Speaker Rossi had promised, or at least the Republicans in the House thought that he promised, that he was actually going to serve as an independent speaker and switch his party affiliation and not caucus with either side of the aisle, which was contingent on their support. Ultimately, that did not come to fruition. And Republicans quickly realized that Speaker Rossi and elevating him to that position was at least a mistake on their part. And so there was about 6 weeks where the House either was not in session or they were in session only to pass constitutional amendments related to child sexual abuse and the ability to bring civil cases without a statute of limitations. Once those amendments were dealt with, and once the Democrats filled those 3 seats at the end of February, we had a new Speaker of the House, and we'll talk about that in a second. So we have the Shapiro administration again in office as of January 17th of this year. We have our governor, who was formerly our attorney general and is from Montgomery County, served as a Montgomery County commissioner, and as well as several years in the State House of Representatives, including the title as Deputy Speaker of the House for several years as well. So this governor comes from experience with working with the General Assembly, working with both Republicans and Democrats, ultimately seen as a deal maker, because it's the secret that is not really a secret here in Harrisburg and nationally, that we know that Governor Shapiro, his intention, his plans are not to make the Pennsylvania Governor's Mansion his last stop. Ultimately speaking, we would expect that he would be on the Democratic Party's ticket for president, not next year, but perhaps in 2028, either for president or for vice president. That is truly where we expect him to go. And so that's both good and bad for Pennsylvania. The good is it's an incentive for him to not only do the job well, but also bring both sides together and ultimately achieve big things. And we're hoping that that also includes long-term care. The governor, in one of his first acts as being governor-elect, had to put together a cabinet. And so these 2 individuals here are the folks that ultimately, aside from our governor, from a regulatory perspective, from an executive level perspective, these 2 folks are the most important because they regulate us and ultimately determine our payments. So we have acting DHS Secretary Dr. Valerie Arkush, and the reason they have the acting title in front of their name is because they have not been confirmed by the Senate yet. That is still pending. We expect that to get done in the coming weeks and months, but they still haven't officially been confirmed, although with the title of acting secretary, they still have the full authority of their office and are able to put a staff together and pursue their agendas. So Dr. Valerie Kush, she previously was the chairwoman of the Montgomery County Board of Commissioners. She and Governor Shapiro actually were on the Board of Commissioners at the same time before he departed for Attorney General. Dr. Arkush is a anesthesiologist by trade, is a physician. She practiced anesthesiology predominantly in obstetrics cases. Then we have acting Health Secretary Dr. Deborah Bogan, who hails from Pittsburgh. She actually previously, before being tapped to be the State Secretary of Health, Dr. Bogan was the director of the Allegheny County Health Department. So she does have experience in the area of managing a health department for the 2nd largest county in the Commonwealth. So obviously well qualified. She also has a background in anesthesiology with a focus in obstetrics. So both the secretaries are physicians by trade and have experience in the healthcare day-to-day operations of healthcare professionals and healthcare facilities. Moving on to the General Assembly. As I mentioned, the Senate stayed in Republican hands. And, frankly, I will say in terms of the General Assembly, once we get into our conversation about the back and forth dynamics between the 2 chambers and the governor, the Senate actually is the most stable body that we have in the General Assembly. They're more reliable because their leadership, the party control has stayed the same, and they have cushion in their majority, whereas the Democratic controlled House has literally zero room for error to pass their agenda. Senator Kim Ward last session was elected majority leader. This session, she was once again promoted by her colleagues and elected Senate president. She's the first female to serve as Senate president. So she presides over the chamber on a day-to-day basis in the absence of the lieutenant governor. We have Senator Joe Pittman from Allegheny County, or I'm sorry, from Indiana County. Joe Pittman was only elected to the Senate 3 years ago. So, relatively quick path to such a high leadership position, but he served as a staffer for former Senator White, who I actually replaced a few years ago. So he comes with years of staff level experience, his knowledge for how the Senate operates, the budget process, and ultimately how to get things done and cut deals is endless. And so he's in really good shape to be a successful majority leader. And then we have Senator Scott Martin, who's now our Senate Appropriations Chairman. I know it looks like on our screen the word chairman got cut off. He is the chair, he's the majority chairman, taking over for Senator Pat Brown, who was defeated last year in the Republican primary for renomination for Senate. But ultimately speaking, as an aside, Senator Brown is now the Secretary of Revenue. So he actually is still in state government and still using his experience as appropriations chairman, just at the executive level, controlling the revenue department, ultimately responsible for tax collections and projections on the fiscal stability of the Commonwealth. Senator Martin's from Lancaster County. He's a really, really good guy who his background is actually in juvenile detention. And we actually met with Senator Martin last week. And, based off of those conversations, sounds like he really, truly understands long-term care policy issues and is ultimately somebody who wants to invest in our seniors. So all three of these folks are really strong allies to PHCA. I and our president and CEO, Zach Schamberg, have tremendous relationships with all three of these folks, see them on a pretty regular basis, and can certainly have access to them as needed. And of course, as we get closer to the budget deadline, that that access is going to be paramount. Democratic leadership, they're still in the minority despite picking up that one seat. Their leadership has not changed. We have Senator Jay Costa, the minority leader from Allegheny County, a really good ally to PHCA, has been very helpful to us in navigating the Democratic administration and the governor's office, as well as our relationship with SEIU Healthcare, as we seek to work with SEIU to find common ground on whether it be regulations, legislation, and budget advocacy. He's a really good broker of those conversations. And our relationship with Senator Costa has certainly been solidified over the last several years. Senator Vincent Hughes is the Minority Appropriations Chairman. He's from Philadelphia County. Senator Hughes does have a seat at the budget table, but because the Democrats are still a couple of seats away from the majority, doesn't have as big of an impact, but obviously, comes from Philadelphia County and has a very loud voice, and one that is also has to be contended with when we talk about state budget advocacy. Switching over to the House side, this is where things get a little bit more murky. The Democrats do have the majority. Representative Joanna McClinton is the Speaker of the House as of February 28th. She's from Philadelphia. Last session, she served as the majority leader. She was the first female African-American majority leader in the House, and now she's the first African-American female to serve as Speaker of the House. She is somebody who was only elected to the General Assembly in 2014. So again, another quick rise to power, to now being the House Speaker. She is somebody who we do have a relationship with and seeks to continue to build that relationship, and looking forward to having continued conversations with the Speaker as to long-term care policy issues and how it relates to ultimately the success of not only her district, the city of Philadelphia, but also the Commonwealth as a whole. Next, we have House Majority Leader Matt Bradford, Montgomery County. Last session and the last few sessions, Matt Bradford was actually the chair of the House Appropriations Committee. Again, from Montgomery County. I'm also from Montgomery County, as is Zach. We have a really great relationship with Leader Bradford now. He is somebody who ultimately speaking, gets that we need to increase funding in the Medicaid reimbursement area to make the regulations that are coming down from the state and possibly federal government practical. A common sense guy who, ultimately speaking, wants to find consensus and get things done. And then finally, Representative Jordan Harris, also of Philadelphia County, is now the new House Appropriations Chairman. Last session, he was the Minority Whip. So new to the game, and so he's probably of the three here, he's got the the most to learn on the fly. Not that being Speaker and not that being Majority Leader aren't important positions; they absolutely are. But you need to understand the ins and outs of the budget, which is massive. It's about $40 to $45 billion every year. He's got to navigate now all the funding requests and has to deal with negotiations with the Republican Senate as well as the governor. So he's got his hands full. He's probably got the hardest job of all three of these folks when it comes to state budget advocacy. And, he's somebody that we've gotten to know over the last several years, and ultimately speaking is a very practical man on the issue of caring for our seniors, and again is also a supporter of increasing funding for Medicaid. On the House side, similar to last session and last previous sessions, Brian Cutler is still the leader of the Republican caucus, albeit now he's the minority leader. For the last few sessions, he was either Speaker of the House or the majority leader. Now he's leading the Republican minority. A really great friend to both PHCA and long-term care. He's been a reliable advocate for us over the last several years. And then also new to the game is Representative Seth Grove of York County, who is the new Minority Appropriations Chairman. He is a conservative. He is somebody who is, ultimately, looking at not only this year, but the out years in the state budget and seeing a lot of red. And so his willingness to spend a lot of money is limited. So ultimately speaking, it's up to us to make the case that in the areas that do see increased funding, that long-term care is one of them. Again, we have a really great relationship with Chairman Grove, but ultimately speaking, his philosophical alignment as to it relates to human services is not necessarily a match, but we do think that we can work with him. So ultimately speaking, we have two new chairs of the House Appropriations Committee. So we're going to be interested to see how that works, because both folks, their staffs, have to get up to speed quickly on the budget process. I should note that, on the Senate side, we have a new majority chairman over there as well, but most of their leadership has stayed the same. So it shouldn't be as much of a crash landing. Moving on to Washington, D.C., I did want to just quickly highlight, obviously we all know that Joe Biden's our president, Democrat. The election in 2022 allowed Democrats to retain control of the U.S. Senate. They actually picked up a seat, so it's now 51-49. Vice President Harris is no longer required to break the tie, so long as all members are present and voting. They're led by Chuck Schumer, who is a senator from New York, so that's the Senate. It's continues to be a very consistent body that doesn't traditionally swing, isn't susceptible to the swings in party control like the House of Representatives, which leads me down to them. The Republicans took control of the House in last year's election. Speaker Pelosi is no more. We now have Speaker Kevin McCarthy, also from the state of California, who had served as the minority leader since 2018 in the U.S. House of Representatives. Folks might remember the early days of January. For those who are fans of cable news and C-SPAN, and I'll admit that I am one of those people. Watching the ballot after ballot after ballot to ultimately elect Kevin McCarthy Speaker of the House the first time that it took more than, I believe, 4 ballots to elect a speaker since the 1800s or so. So he's in control. The question remains how long and how much control does he have over his caucus. But thus far, things have seemingly gone pretty well for those folks. In Pennsylvania, we have our 2 Democratic U.S. senators. We have Senator Bob Casey, who is the chairman of the Senate Aging Committee, up for re-election next year. Our newly inaugurated Senator John Fetterman, who won in 2022 over Dr. Oz. He's obviously also now our U.S. Senator. We did lose a congressional seat thanks to the census and loss of population. So we only have 17 U.S. House seats over the next 10 years. The breakdown there is 9 Democrats, 8 Republicans. So ultimately speaking, things in Washington, D.C., pretty challenging for the president to get his agenda done, given that he's got divided government to contend with. And ultimately speaking, the environment in Washington doesn't exactly lend itself to folks working together across the aisle. So not really confident that any major policy proposals are going to be able to move through Congress over the next year and a half. What we're seeing, and we'll talk about in a little bit, our biggest concern as it relates to federal government policy comes from the rulemaking process, the regulatory process through CMS, and we'll talk about that momentarily. So, as I mentioned, federal agenda, what does that actually mean for us? So we have a couple of rules that we've been monitoring, and actually very timely. One actually just came out yesterday on payment. We have a staffing study and ultimately a staffing minimum rule that we're awaiting from CMS. And then we have a impending payment rule that actually, again, came out yesterday, seeks to increase Medicare funding 3.7%. When it really comes down to it, it's about it counts to about a market basket increase, not tremendously, obviously don't want to diminish that it's not a cut. But when we actually look at what the increase goes to, it's not anything significant and worth getting excited about, frankly. So that payment rule did come out yesterday. We're still awaiting the staffing, both the study and the rule. We expect that it could come any day. We've been told by either the end of April, beginning of May, and we'll take the summer, of course, to flood CMS with comments about whatever their proposal is on staffing, and ultimately going to need our members to help us with that. We have been in constant communication with Senator Casey, who, with his position as chairman of the Senate Aging Committee, has a very loud voice and a seat at the table with both CMS and President Biden on where to land on enacting a minimum staffing standard in nursing homes nationwide. Through our conversations with Senator Casey, he does say he gets that, we have to, if the federal government is going to, for the first time, enact a minimum staffing mandate on nursing homes, it has to be an attainable mandate, i.e. 4.1, which we recently defeated here in Pennsylvania, is not something that Pennsylvania providers, and frankly, providers nationwide, because in the state of New York and in the state of Rhode Island, they've got 4.1, and they're having all kinds of trouble meeting those regulatory requirements. So we've been really pushing Senator Casey on, ensuring that what comes out from CMS is attainable from a staffing perspective, but also is funded. Oftentimes, both state and federal government like to pass along regulations, not only to healthcare providers, but to business and industry, and their unfunded mandates. And in our industry, we can't afford another unfunded mandate. And we can't necessarily rely on our state government to bridge the gap between the federal mandate and increasing reimbursement on that end, because frankly, when we did calculations in 2021, as we were fighting through DOH's 4.1 initial proposal, the cost estimate at that time conservatively was about $1 billion to enact 4.1 just in Pennsylvania. And minimally 7,000 new direct care workers. There's no way that this Commonwealth can carry that financial burden. And even if they could, finding 7,000 additional workers is something that we know is a bit of a stretch. So we've sent a letter to both CMS and to Senator Casey. Senator Casey has been advocating for a staffing minimum, though falling short of the 4.1 PPD. He's still pushing for a minimum. And as I mentioned, we responded to the senator, really highlighting the workforce concerns and talking solutions. When we talk about increasing staffing, obviously every provider wants to be able to hire more staff. Everyone needs more staff, but we can't necessarily put the cart before the horse. What are we doing as a state and as a country to grow healthcare workforce? There are things that should be addressed, whether it be childcare, transportation, immigration reform, those types of problems, those societal problems that are much larger and out of our control need to be addressed by Congress before just passing along a staffing mandate and asking folks to hit it by an arbitrary deadline. Additionally, last month, the HELP Committee, Health, Education, Labor, and Pensions Committee, chaired by Senator Bernie Sanders, they held a hearing on staffing in nursing homes, and there was a call for input on what staffing looked like in healthcare. And so we actually, PHCA, took the liberty to respond to Senator Sanders' call to action, and we laid it out very frankly with him, using results of a recently released nursing home survey from our providers, and sharing that we still have an access to care crisis in Pennsylvania, and it's no different nationally. And ultimately speaking, we need our state and federal governments to set us up for success before, again, arbitrarily picking a number and saying, hey, you gotta hit this tomorrow. So that was going on at the federal level, the fast and the dirty there. We're going to continue to advocate and communicate with not only Senator Casey. We've talked to Senator Fetterman. We've talked and we've been in contact with every member of the Pennsylvania congressional delegation, letting them know that what they may be supporting or seeing out of Washington is going to have pretty substantial consequences in their own backyard, in their own districts, as it relates to whether or not nursing home providers are going to be able to continue to meet staffing metrics. And it also has an impact on our ALPC providers as well, because the more nursing facility providers have to increase staffing by way of regulation, it does lessen the pool and impact ALPC staffing as well. So this is our prime focus over the next several months. And as I mentioned previously, we're going to need to flood CMS with comments. Obviously, our national association will, PHCA will have their own comments, but individual comments from providers and at the facility level on that federal rule when it comes down is going to be crucial to hopefully turn around CMS depending on what that rule actually says. So stay tuned there, but that is our prime federal focus. Next, I want to talk about the 2023-24 state budget. But before that, I did want to just go back. Some of you have seen this many a times and are well aware of what we accomplished in 2022. Historic funding. Not only did we receive another infusion of ARPA funding for both skilled nursing and assisted living personal care homes, for the first time in nearly a decade, or just about a decade, received a rate increase, and not just any old rate increase, a historic largest rate increase in state history, 17.5%, which roughly, as you see there, about $147 million state share gets a federal match. On average, accounts for a $35 per resident per day increase in Medicaid reimbursement. And you'll see there that the way the calculations were formulated, specifically on the ARPA component of things, the way we have the calculations formulated, PHCA members actually received a higher average of funding as opposed to non-PHCA members. So just wanted to point that out as well. So before we talk about our budget ask, I do want to talk about Governor Josh Shapiro's first budget proposal, which was on March the 7th. By all accounts, going into that budget proposal, we were not sure where the governor would lie. For those of you who have been around for a bit, you might remember Governor Wolf's first budget proposal, where it was massive increases in spending, very, very, very progressive proposals that were met with a buzzsaw by a very conservative Republican General Assembly. That led to about a 11-month budget standoff and wasn't really good for anybody. The question that most folks had was Governor Shapiro, now with a Democratic House, so actually at a bit of a better advantage than Governor Wolf, was he going to come in and go full throttle and try and get all of his priorities into this budget and fight tooth and nail with the Republican Senate? Or was he going to take a step back approach, be conservative, pass a budget in his first 6 months in office that frankly didn't upset, didn't cause any waves and frankly was a very balanced middle of the road proposal? And so what we got was the latter. So a conservative budget proposal, not conservative in the sense of conservative priorities from a philosophical issue, but from an actual funding perspective. It is a proposed 7.9% increase in spending overall, but last year's state budget actually was buoyed a lot in part by ARPA federal stimulus dollars. So you have to take that into account. So what the governor's actually proposing in that, call it 8% spending proposal, increase spending proposal, isn't as eye-popping as you might think. Kind of the highlights, from his priorities is number one, minimum wage. Governor's calling for a $15 minimum wage effective January 1 of 2024. Don't believe that is in the cards. Obviously, the governor in some aspects is just checking the box and saying this is a wish. Depending on who you talk to in the Senate and in the House, on both sides of the aisle, everyone has opinions on whether or not there will be a minimum wage increase as part of this budget negotiation over the next several months. From what I'm hearing, the Senate Majority Leader is saying no way, no how. The market has already moved to a $15 or higher minimum wage. Very rarely are you seeing folks making the actual state minimum wage, which is $7.25, which was last increased the last year of Governor Ed Rendell. So the Senate's taking the position, the Republican Senate's taking the position that we do not need to raise the minimum wage because the market has already moved. House Democrats, their majority is saying, no, we absolutely do need to raise the minimum wage. They're looking at 15. Ultimately speaking, I think there's a deal to be had. I do not believe, or we do not believe, that we're going to get $15 beginning next year. I think if there is movement, you'll see maybe a movement immediately to $10 or $12 an hour in that range, with a scale step up to $15 over 2, 3, or 4 years. So keeping an eye on that. Also happy to see that the governor's proposing increases for child care services for low-income families. As we know, child care is one of the biggest barriers of folks entering or re-entering care workforce. And so those investments are something that we're happy to see. This governor has continued what the last 8 years of Governor Wolf have had, which is record increases in education every single year, basic education, K-12 education. So that is no different. An interesting proposal here, a tax credit of up to $2,500 per year over 3 years for new nurses, law enforcement officers, or teachers. Again, it's our understanding, based off of the limited information provided by the governor and his administration, is it's for recruitment, not necessarily for retention. And the definition of nursing is also at question. Are we talking about RNs? Are we opening it up to LPNs and CNAs as well? The devil's in the details on whether or not this is actually going to be helpful to long-term care, but we'll keep you posted when we have more information. And then finally of note, the governor is proposing a $1.3 million increase to the Department of Health to implement the agency statute. As you know, last year we were very successful in getting legislation signed into law by Governor Wolf to provide oversight and transparency of staffing agencies. That language, that legislation, and the process to oversee staffing agencies to require them to register has not been implemented yet by the agency. They're saying that they need this additional funding in order to hire additional staff to implement the act. So ultimately, we're supportive of increasing that funding because we want the bill that we just fought very hard for and we believe is very important to long-term care to be implemented. So stay tuned on that. In terms of, the big picture item, what did the governor, if anything, propose for Medicaid for nursing homes? In his budget address and in the documents that preceded it, no increase. It was flat funded. However, in recent days and within the last week, it does now look like the governor perhaps is proposing about $15.8 million in state funding, gets a federal match, call it $31 million total, to meet the year 2 staffing ratios beginning July of 2024. That 15.8 million is well short of what PHCA assumes the cost is going to be. So that brings us to the next point. What is the Pennsylvania Healthcare Association budget ask? Well, we have several components. The first is on the Medicaid, realm of things. Overall, we're asking for $99.1 million state share. And that $99 million is broken down. You'll see the first bullet, funding for the year 2 staffing ratios. We assume a cost of approximately $57 million. So again, far short or far higher than what the governor is potentially proposing as about $16 million. Operational viability, $42 million. That's for the assumed cost of increased food supplies, medical supplies and equipment, things of that nature. As inflation has increased, as expenses have gone up, we have assumed in our ask those types of variables to, ultimately speaking, again, come to a $99.1 million budget ask. You'll see at the bottom of the slide here, that's an average of $12.50 per resident per day added to Medicaid rates. The new target rate would be about $247 per facility on average, which is about a 5.3 increase over last year Medicaid payment. The other 2 items, I'll start with Medicaid Day 1 incentive, or MDOI. That is something that it's been in place for years now. It's a legislative ask and add-on. It's stuck in the fiscal code that gets done with the state budget every year. We're asking the funding to be sustained at $16 million and gets a federal match. And then talking a little bit now about the quality incentive payment. This is something that's new. And ultimately speaking, been advocating for additional funding to actually roll through this QIP program that's being piloted through the Department of Human Services. Before we talk more on that, just an FYI, you probably all are well aware, these are the staffing ratios that begin July 1 of this year that are funded through the 17.5% Medicaid increase we received last year. We go from a 2.7 PPD to a 2.87, so not as significant as a jump as we will see next year when we move from a 2.87 to a 3.2. And then again, these ratios are really the key here. And again, unfunded, we're working to ensure that we do not have an unfunded mandate on our hands. Ultimately speaking, not getting ahead of ourselves, but if these year 2 ratios aren't funded, our recourse will then have to go back to the administration, go back to the Department of Health and advocate for the suspension of the year 2 ratios in lieu of any increase in funding that was not obtained. When we're talking about the quality incentive program, or, I mentioned DOH, I'm sorry, I should say DHS is actually is piloting a program, 7 million state share. And really the Shapiro administration believes in reimbursing for quality care, incentivizing quality care. And so do we. They're looking at for this year to incentivize based off of several metrics. You'll see them here, rehospitalizations, antipsychotic usage, staffing, falls, all things that they're going to be taking a look at reports and providing increased payments. The lower, these items are, except for staffing, the higher likelihood that you'll be able to receive a higher reimbursement. This is the way of the future for our reimbursement system. 20 states and the District of Columbia have value-based purchasing models of quality incentive payments. Managed care organizations in Pennsylvania have been directed to get there by 2025. And again, the Shapiro administration believes in investing in quality, and therefore, it's instrumental and crucial for us as an association, as an organization, to also be rowing in that direction as well. What we really want is to have a seat at the table, to really be able to dive into the quality metrics that are going to be used and ensure that they make sense. Because ultimately, quality metrics, it's not a one-size-fits-all approach. Every facility is different. You have some facilities who, depending on what metrics you use, are going to be set up to fail potentially. And that's what we're looking to avoid. So that is, secondary in terms of what we're advocating for this year, is really trying to, push that conversation and be at the table. Obviously, Medicaid funding for the year-to-year ratios and that operational viability is really what we're focused on in the next several months. And then again, MGOI, just, again, $16 million since 2019, receives a federal match. Nothing will change in terms of, or at least it's our intention that the language stays the same, and should just be sustained this year. In terms of our messaging over our budget ask, as I said earlier, we released a nursing home survey last month that showed, that the access to care crisis in Pennsylvania remains high, that we remain in a workforce crisis, and that, now's not the time for the General Assembly to think that they did a quick patch last year with that 17.5%, and then they can walk away from us and ultimately, flat fund us for the next several years to a decade and expect that the continuum is going to be able to survive. Obviously, we all know that that's not the case. Recently, in the last few days, we released a ALPC survey that also showed similar challenges for ALPC providers, and really raising awareness for the need. We'll talk about that next in terms of our budget priorities. Really trying to get assisted living authorized in the Medicaid program. But first, what are our challenges for the next couple of months? Well, again, historic Medicaid increase last year. It's very hard to obtain two significant rate increases or batches of funding from the legislature and the governor back-to-back years, unless, of course, you're the education sector. They're the only folks that seem to be able to pull that off. So there is, we can, and haven't really heard it yet, but can run into the claim from the legislature. Well, we just gave you 17.5% increase last year. We can't help you this year. We can't take care of you every year. Fiscal realities, in the out years, things aren't looking very rosy in terms of revenue collections in the state. That's why they have to look at, they have a couple of options at their disposal. They can do a broad-based tax increase on sales and income. They can look at expanding revenue opportunities by legalizing marijuana, expanding gaming. These are all hot, really touchy political issues that, going to be hard to get consensus of how to increase revenues to balance budgets in years to come. Other challenges, again, we have a new administration. They're unfamiliar for challenges. We have a lot of work to do. We're meeting with the new Secretary of Human Services next week. Also awaiting a meeting with the new Secretary of Health, and really just having them understand, at least at a 30,000 feet level, what our challenges are. And of course, there's new staff in the departments as well. Chaos in the House of Representatives at 101-100, which is the current makeup of the House. things can, with a 1-seat majority, things can change pretty quickly. And then obviously the Senate holding the line on spending, that's kind of been what they've been most interested on. Got to work through those challenges as well. If the Senate's not willing to spend the money, it becomes increasingly difficult for us to get the Medicaid increase in this year's state budget. Wanted to provide now a legislative update in terms of what are we working on here at PHCA aside from the state budget. So the first bullet point here, certified medication has been a priority for several years, and we're finally at the point where the Department of Health isn't going to just create a Medicaid, it isn't going to recognize and create a training program for certified med aides. So we're going to have to legislate it. 36 other states have some sort of medication aid in nursing facilities. We're trying to be the 37th. Essentially, the language is we have a co-sponsor memo out, sponsored by Senator Judy Ward from Blair County and Maria Collette from Montgomery County. Both are nurses and had served in nursing homes in the past. But essentially, after 1 year of consecutive service in a nursing facility, you would be eligible to take a certification course, minimally of 40 hours, although the department has some leeway to increase that. And you'll be able to administer certain medications as a CNA, being certified as a CMA. You'll be able to administer certain medications and hopefully do two things. One, create a career ladder in long-term care where folks can come in at the CNA level and possibly, if interested and if qualified, transition over and be certified as a certified med aid. Not only does it increase their skills, but it also will obviously come with increased wages as well. Also helps the provider to be a little bit more creative and flexible on staffing. I will note, we've been working with SEIU on this language in terms of how it would count. As of right now, it would count towards the overall PPD. They're not at this point willing to allow us to count CMAs in the CNA ratios. That's something that we're still working through, but it seems doubtful, but at the very least, they'll count in the PPD. SEIU, their support on this bill is crucial because obviously the Democrats control the House and they're very closely aligned with SEIU, as is the governor. So that's CMA, hoping to have the bill introduced in the next several weeks. And it's our hope that this is a non-controversial piece of legislation that can move quickly through the General Assembly and get to the governor, perhaps even by the budget deadline. Stay tuned for more updates there. Medicaid and assisted living now officially has a bill number this session. It's Senate Bill 520, sponsored by Michelle Brooks. She was our sponsor last year. Chairman Brooks, thankfully, is the chairwoman of the Health and Human Services Committee, which is the standing committee that ultimately SB 520 will be referred to. Last session, the bill went to Chairwoman Brooks. She kicked it out of committee pretty quickly before it died. The problem we have with MA and AL is that every year it gets attached a fiscal note or a cost to implement that has to be done by both DHS and the appropriations committees of about $100 million year in and year out. That's something that has always scared away folks on both sides of the aisle, frankly, from implementing Medicaid and assisted living. This year, we got a little bit new, a bit of a new strategy, which is, we've met with UPMC and they themselves, without having to be legislated to do so, are looking at doing in lieu of services, essentially, in certain cases, allowing for Medicaid to pay for assisted living placement. And, we still have to get the other managed care organizations rowing in that direction. But if UPMC is doing it, it's probably only a matter of time before the others follow suit. Our strategy at this point is to strip out the language of SB 520 that specifically authorizes assisted living in Medicaid. That would eliminate the $100 million fiscal note and make the bill more viable through the General Assembly. What the bill would then contain would just be language on modifications, waivers to modify personal care homes in certain aspects to potentially be able to be re-licensed as an assisted living, and then could also take part in getting Medicaid funds as well. That's the strategy there. Still gotta get through DHS, and that's a little bit more of a messy process as opposed to the certified Med Aid proposal, but it's a little different. It's a new strategy because what we have been doing, which is trying to get the current language passed, just hasn't been working because of that disconnect. So stay tuned for additional updates there, but hopefully some movement. Finally, still working on a personal care attendant concept, which is kind of building off the TNA program. And when we talk about career ladders, coming into a facility perhaps as a personal care attendant, which is a lower training as compared to the actual CNA process, gets you in the door faster, and then immediately on the job training to become a certified nurse aide. Helps facilities in limited capacity to provide some aspects of care, but again, a lower barrier of entry into nursing facilities. And then, ultimately you're still going to be required within a certain period of time to transition to a CNA at least. But again, just trying to add another couple rungs here in the career ladder of long-term care. Defense measures. State False Claims Act is back and is actually a pretty decent threat this session. Both Republicans and Democrats, not all of them, but there does seem to be some bipartisan support to enact a State False Claims Act. Obviously, we do have a Federal False Claims Act, so it is our position that it's duplicative and unnecessary to have a State False Claims Act, especially since the language would allow, private citizens to bring about claims of Medicaid abuse. We're still working through, two things. One, just playing defense and trying to prevent language from going through the legislative process entirely, or there's a deal to be had, is there some neutral language in there? Is there a way to nullify it so that it really doesn't impact our providers, or at least lessens the burden? Those are conversations that we continue to have, but just know that that's something that's being considered. Ultimately speaking, defense of any unfunded mandate, trying to ensure that as lawmakers get all these great ideas, that if they're going to cause burdens to facilities, especially from a financial perspective, that those are defeated. Change of ownership. I know we just went through change of ownership in the nursing home regs. We're probably going to see something from the federal government as well. But there is folks who in the Senate particularly still want to do some additional legislation, a little bit more rigorous legislation on change of ownership that we absolutely oppose. And then finally, the Patient Safety Act predominantly pertains to hospitals and RN nursing ratios. Nursing homes were included in the legislation last year. It does look like after multiple conversations with the prime sponsor, SEIU and other stakeholders, that this session is going to be introduced without nursing homes in it, which is good news because the ratios that they have for nursing home providers was, I think, the calculation that Zane Barrick, our director of data, came up with was, I think, additional 40,000 RNs would need to be hired just for nursing homes. Excuse me, and that's before we even get to hospitals. So obviously way out of whack with reality. It looks like we're going to be removed from the bill, and hopefully I can fully cross off Patient Safety Act as something that we have to play defense on in the coming weeks and months. Next, I do want to talk again about advocating for long-term care and advocacy 101. Obviously, the 17.5% rate increase last year, the 3 years of federal stimulus dollars, the countless pieces of legislation that we supported and proposed that have been enacted wouldn't be possible without our advocates, not only from myself, Zach, our external lobbying team, but specifically from our boots on the ground, our members in facilities who are doing this work and are constantly, engaging lawmakers in their own backyard to say, here's what our challenges are, here's what we think the solutions are, here's what the solutions certainly are not. And advocating and succinctly communicating what our positions are, the advocacy cycle is ultimately how we achieve record funding like last year, and we continue to get bills signed into law. It's crucial to, identify the issue, which, in this case, we'll talk funding, set our objective, which is our budget ask, identify the policymakers, the decision makers. That's the legislative leadership that we talked about and we identified earlier on in the slides. Setting our timeline, which is frankly from March 7th, the day the governor gave his budget proposal, to June 30th, the deadline for the budget to be enacted. Resources, tactics, we'll talk a little bit about our rally day. We'll have a grassroots one-click advocacy campaign going where you can send emails directly to your lawmakers, phone calls, etc. Monitor, elevate, and share, which is, just stay in tune with what, the association's asking our advocates to do to really help push the envelope to get our goals achieved. Things to remember when you're talking to lawmakers, obviously, tours are always a great thing, especially as we get more, in the day-to-day, living with COVID and having folks back in our facilities, bringing lawmakers back. There's over 50 new lawmakers in the General Assembly this session. It's a very high number. That's 50 new lawmakers that we need to educate. And one of the best ways to educate is to actually have them see it, feel it, come to your facility. Town halls, bringing lawmakers into facilities to talk to residents, to meet with residents, to do activities with residents. That's a great idea. And honestly, just taking time to reach out, go to their district office, have a phone call, and just introduce yourself, introduce your facility, your provider, organization, and just let them get to know you, so that rather than perhaps calling me and saying, hey, this is what I'm thinking on long-term care policy, even better, they're calling you directly. And that establishes a really strong relationship and bond. Again, these are just advocacy methods. Very classic is the person-to-person and letter writing, and the phone calls. All three of these are extraordinarily relevant and effective, as is, we're in a highly technical world these days, especially after the pandemic. I do a lot of my meetings via Zoom these days. It's just easier rather than having to set up a time for an in-person meeting, which might take weeks. Folks have a lot more flexibility to meet virtually. Reaching out respectfully, of course, via social media, shooting a tweet or a DM through Facebook or Instagram, and of course, good old email. As I mentioned, inviting lawmakers to facilities. We've had several days of caring that PHCA put on across the Commonwealth, where we brought lawmakers to facilities to say thank you to our workers, to raise awareness for the need to put the industry on a sustainable path. Not only good to bring lawmakers into the fold, to have them understand the day-to-day aspects of how your operations are run and your needs, but also gains press and certainly puts the conversation out there to the general public as well. Rally Day, this is from last year. We had a great turnout, meeting with members of the General Assembly coming to Harrisburg. This year, we're excited. We've got a legislative conference that'll take place on Tuesday, June 13th at the Harrisburg Hilton. CEUs will be available to learn more about the advocacy process, more about our priorities, hear from lawmakers and staff, and a more robust training on advocacy. And then June 14th, the very next morning, hitting the Hill, meeting with our lawmakers and making the case. Same thing in Washington, D.C. a week earlier with ACA and Cal. Going to Washington, D.C. This is again from last year with Congresswoman Madeleine Dean and several of our members, and talking specifically this year about the federal staffing minimums and advocating for the industry, what it needs, the support it needs, and certainly what it does not need in lieu of or in terms of very unattainable staffing mandate. And I know we're up against it, so I will end with just saying connect with PHCA, follow us on Twitter, follow us on Facebook or LinkedIn. That's where you're going to get a lot of advocacy updates and really stay in touch with what we're working on day to day in Harrisburg and Washington, D.C. And it's also great to reach out to us there as well. I will stop there. I know it's 11, so folks probably have to move on, but if there's any questions, happy to answer them now, or if you'd like to shoot me a message afterwards, happy to continue the conversation. So Kim, I will turn it back to you.
Thanks so much, Tim. I'm looking at the Q&A channel and I'm not seeing any questions that have been presented yet. As always, if after today's session, anyone has any questions at all, please reach out to Tim or myself, and we will get right back to you. Tim, thanks so much for your time today. I appreciate you sharing this information with us.
All right, thank you, everyone. Have a good rest of your day and a good week.
Thanks so much.